Hey guys, Dr. Ben here, your functional medicine expert, and I'm holding a bottle of Ritalin, and I want to go over today the top 5 questions to ask before putting your kid on Ritalin, Adderall, any ADD medication. And one of the things that we look at is there are very specific things that happen to the body when we put these medications onto our kids, and a lot of them can have detrimental effects. But some of the questions you need to ask are, is this really ADD? And if it's not ADD, what is the underlying problem? So many people get diagnosed with ADD. We do brain maps all the time in the office. 2013, the FDA approved the brain map as a diagnostic tool for ADD. And guess what? Not everybody that gets diagnosed ADD has that specific brainwave pattern. There's other things that can be going on. They can be having an anxiety pattern. They can be having a lot of different things that can be contributing to this, and it's not a true ADD pattern. The next thing that you need to ask is this really a neurological imbalance or a biochemical imbalance, or is it some of both? Many of our patients, we see that it's not just a neurological component or not just a biochemical component. Taking Adderall, Ritalin, any of the ADD medications is making that assumption that it is primarily a biochemical issue, and that by taking the medication it's going to change the biochemistry. What we find is many patients have neurological imbalances, brainwave imbalances, where they may not be able to focus as well as they should. That focus wave crashes, their daydreaming wave may be too high, and we actually need to change the brainwave pattern in addition to helping their biochemistry. The other question you need to ask is what type of side effects they're going to have. We have a lot of patients that they lose weight, their hunger goes away, they're just not eating very much. It can affect their moods on other sides. Maybe they can focus, but they're having other mood issues. So you've got to ask the questions about what potential side effects are there. And then the fourth thing that you need to ask is, will taking this medication actually fix the underlying why? Functional medicine is all about the why. We've got to figure out why the body's going haywire, what needs to be changed. The underlying why is that taking medication is not fixing those problems. The underlying why is it blood sugar? Is it the neurology? Is it the inflammatory process? Did they have a head injury? All these other things can contribute to it, and just by taking a medication will never fix that. The research showed they compared neurofeedback to Ritalin, and they both decreased the amount of ADD pretty significantly. They stopped both treatments for 6 months. The Ritalin group went right back to where they started. The neurofeedback group maintained the changes that they had seen the entire time. So those that take Ritalin, Adderall, any of these drugs are not getting lifelong changes. It's a temporary fix. And then looking at the last question is going to be, what other tools are out there? What other things can we use to help our body get better? And that's when we look at the brain map and using the neurofeedback. We've got cold laser to help blood flow to the brain. We've got oxygen therapy. If somebody's had a head injury, we can get more oxygen going to there. On the metabolic side, stabilizing the blood sugar, looking at the liver, detoxification pathways. All these other tools are out there to change your child's brain and change their perception of how the world is interacting with them. Check out our other videos. We have a lot of information out there. You need to educate yourself, understand your options besides just taking medications. We've got a lot of great, easy to understand videos out there. Check them out on our page.